My name is Linda Swenson, and I'm from Mill Creek, Washington. I didn't even know that I had scoliosis until I had a kidney stone, and the doctors at the emergency room took an x-ray, and they said, my goodness, you've got quite a curved spine. And so right away I went to a spine specialist, and he said it wasn't bad enough to operate on. So then a couple of years later, I started to really have pain in my spine. And I went to another specialist, and he was really good. I had probably about 4 different cortisone shots throughout the next 3 years. And each time I got a shot, it really did help. And each one would last about a year. And then I'd start getting this pain again, severe pain. So then he suggested I see a specialist because he said, really, another cortisone shot, it wasn't going to help me. And it had gotten pretty severe to the point where I was taking a walk with my son one day, and I felt like I was walking through mud. My feet just would not go heel to toe. So then that's when the doctor said, well, you have to see a specialist. And so he recommended Dr. Oskilian.
Linda was referred to us with pretty severe scoliosis, and she had gotten to the point where she had a real neurologic deficit, and she was in excruciating pain. There's no question that there's a group of patients who will benefit from having surgery like Linda, but we like to exhaust all other resources before we even consider doing a big surgery like that.
I was certainly scared and frightened of going in for such a major operation. Dr. Oskilian really explained and showed me photos and gave me the information, told me that really this is pretty severe and you really should have the operation, or I could end up in a wheelchair not being able to walk at all.
As you can see on the preoperative x-ray, there's a severe scoliotic curve going off to one side. The deformity was corrected in 2 stages. In the first stage, we go in and release the spine anteriorly and open up the channels where the nerves go through. And then the stage 2 involves completely trying to pull the spine back over. The postoperative x-rays show the correction, and you can see how straight her spine is now. You can see a big difference too. So before is where she was hunched over and had a foot drop. Now she's straight and her foot drop's gone. There's a bit of recovery. I'm trying to build up my stamina a little bit so I can walk along the beach this summer because I love to hike. You know, she's walking now. Her leg strength is almost back to normal. But what makes me even happier is the fact that she's so happy and is pain-free and is walking around just as she did 5 years ago. Dr. Oskilian and the nurses and doctors here, I was over-delighted with everybody. I would totally recommend Swedish for anyone who needed to come in and have an operation. It was great. I mean, the people here are great.